Good morning and welcome. I'm Paul Carson, Training and Development Specialist with Care Oregon's Pharmacy Department. And I'd like to welcome you to yet another edition of Meds Ed, our ongoing educational series targeted towards folks involved in primary care in the state of Oregon. This morning's session is entitled Community Health Workers on the Front Lines of Reducing Health Disparities. Now, within the framework of our friends at the Oregon Health Authority's CCO 2.0 priorities, they made changes to improve the behavioral health system, increase value and pay for performance, focus on social determinants of health and health equity, and maintain sustainable cost growth. Part of that is formalizing this new provider type around community health workers, and it is frankly revolutionary. Because of these integration plans, all of our members now have the right to access a community health worker to be able to assist individuals in their community to achieve positive health outcomes. And it's important to know, this isn't some brief pilot idea that's going to be here and gone. This is community health worker providers are now a permanent fixture in the care landscape of the state of Oregon. It is cause for celebration, definitely a big deal. Community health workers, they serve as a bridge between clinicians, their patients, and their communities. Their unique knowledge and skills can support providers to build a deeper understanding of the communities they serve and fine-tune their approach to help patients with complex needs improve their health and avoid costly things like emergency department or hospital visits. Community health workers are members of the communities they serve, and they could build strong, trusting relationships with their patients. This allows them to successfully address those social determinants of health, help reduce health disparities, and improve the kind of experience patients have with their care. When fully integrated into those primary care environments, community health worker programs have been shown to help improve disease outcomes for patients with asthma, hypertension, diabetes, cancer, tuberculosis, HIV, AIDS, and depression, all kinds of different conditions. Are extremely beneficial. So this morning, we're going to look at the integration and the value of community health workers in primary care, how relationships with clinical staff make for effective collaboration, as well as the intersection between those community health workers and health equity during this pandemic and beyond. Real briefly, I just want to take you through the agenda that we have here today to have a sense of what's happening. To begin with, we're going to be getting an overview of the role of community health workers from our good friends at ORCHWA, Oregon Community Health Workers Association. We're also going to be fortunate enough to spend some time with a trio of seasoned community health workers who are doing a panel representing Multnomah County from all across the area there. And then we're going to be getting a really interesting insight into our friends at Mercy Flights and the collaboration they've been able to achieve with pharmacy. Really fantastic. And then we'll close things out with a look at how this kind of support mechanism is integrating itself into the CCOs so that we can really provide the most enduring, lasting foundation for these new roles. Pretty darn exciting the way this is going. So you'll learn more about that integration and support as well with our liaison folks. When we are concluded, as many of our panelists who are able to remain will be joining us for a Q&A session. We've got that chat feature working throughout our webcast this morning. A lot of our presenters may ask questions. Use the chat to respond and ask any questions that you have as we go forward, and then they'll do their best to be able to answer those when we get to the live Q&A. Here's a glimpse at our overall learning objectives that we'll be covering this morning, representing all the different sections. And of course, you've got the option to turn your time in for some nice continuing education credits, either AAFP CME, Oregon Board of Pharmacy hours, community health worker, or National Association of Social Worker credits. So anyone who's a enrolled participant today will get survey links from me, and you just basically go to the right survey that's appropriate for the kind of hours you need credit for, and we'll take care of the rest. So pretty straightforward. All right, I think we've got everything plugged in together here for you. So I'd like to go ahead and move into introducing our first pair of presenters to kick things off. I think you're in for a good morning today, friends. So thanks a lot for your patience as we get started. As I mentioned a little bit earlier, our first presenters are with ORCHWA, the Oregon Community Health Workers Association. Janine Smart is ORCHWA's executive director and has worked in the healthcare and public health sector for over 18 years. Her experience is rooted in advocacy, social justice, and anti-oppressive practices. She is a strong advocate for collaborative, inclusive systems that enable communities most impacted by systemic and structural oppression to thrive. Janine believes that community health workers hold an instrumental role in addressing health equities. And joining her today is Yessie Castro, ORCHWA's Workforce Development Director. With 10 years of experience working with low-income and migrant farm workers out in Hood River, where her prevention work earned her a National Recognition Award for all of her efforts there. She's worked closely with leadership in environments such as schools, transportation, city governments, health systems to help ensure Latinx inclusion and voices in different community initiatives. Yessie is passionate about social justice, equity, changing systemic oppression, all to make for better health outcomes. Wow, I'm ready. Are you ready? Please join me in welcoming our first presenters, Yessie Castro and Janine Smart.
Thank you so much, Paul, for the kind introduction. We are thrilled to be here talking about community health workers. Again, my name is Janine Smart, and I'm the Executive Director for the Oregon Community Health Workers Association. I have been at ORCHWA for approximately 11 months.
And my name is Yessie Castro. I'm the Workforce Development Director here at ORCHWA, and I've been here for about 3 years now.
So a little bit about the Oregon Community Health Workers Association. It is also known as ORCHWA. And ORCHWA is a statewide community health worker professional association. And we serve as a unified voice to empower and advocate for and with community health workers and our communities. We work together to advance community health, social justice, and equity. And I am so excited to announce that in November, we will be turning 10. Hooray for ORCHWA.
Happy birthday to us.
So a majority of our programs fall within 4 main buckets of work. We have policy and advocacy, community programs, workforce development, and technical assistance. So one of the things that has been so important and foundational to the organization is our work in advocacy. So prior to community health workers being super sexy and desirable like they are right now in the existing context, they weren't thought about as much for larger systems and organizations. And so ORCHWA really sat in this space of pushing towards recognition of the workforce, not only for the impact that community health worker work has on public health, but also the important and amazing work that community health workers do in the community space. And so historically, we have been very tied to policy and advocacy work. And what that looks like now is really supporting around workforce development and sustainability, education and partnership, and encouraging community health workers to be leaders and leading into that space around the policy work, providing educational opportunities, and keeping folks informed around different policies that are happening that are impacting the workforce. We currently have limited capacity around policy and advocacy, but are looking to expand in that area, and not only so that we can make sure that we're engaged on a state level, but also in the space in a national level, national conversations around the work and policies that are impacting the community health worker workforce. Another bucket of work is around community programs. And historically, we had the Warriors of Wellness program, which has since sunsetted, but that work really looked at supporting integration of community-based and community-employed community health workers in clinical settings, and making sure that the clinics where the CHWs were involved were able to support member access to community-based community health worker services. Currently, the community programs is comprised of the Community Education Worker Program. The community education workers are trained community health workers who have additional knowledge and experience in navigating education systems and support families with young kiddos who are ages 0 to 6 in navigating the education system. And really it focuses on families who are most impacted by inequities. Another program of ORCHWA is the workforce development. So in workforce development, we know it is incredibly important to support the needs of the workforce, which means providing professional development opportunities and hosting the 90-hour or the core training to get your initial certification to become a recognized community health worker. So in that program, we are expanding our offering around the 90-hour training. We'll be providing more trainings. We know, again, because it's super sexy to be CHW, there is such high demand to get folks trained up. So we are increasing our training opportunities, and we're also building out our CEU calendar. So there's an expectation that if you are a recognized community health worker, to maintain that certification, you need to take 20 CEUs over the course of 3 years. So we have multiple opportunities for professional development and the CEU trainings, which we're continuing to build out. Another area of our work is in technical assistance. And this hasn't been a formal program for us, but over the course of the last 10 years, ORCHWA has been asked regularly about how to set up community health worker programs. What kind of infrastructure is needed? What does a job description look like? What is the scope of a community health worker? And in varying capacities, that support may look very different. It may look different to provide support to a health system in looking at promising practices to support retention rates of community health workers than it may look in a community-based setting. And so this is something that we're really working on fine-tuning is our technical assistance area. So we're building that out, and I would encourage you to stay abreast to where we're at as an organization. Come back to our website, check us out. We'll be building a menu for technical assistance. So Yessie, can you share a little bit about what a community health worker is?
Of course. Community health workers are helpers in our communities. They are leaders in our communities. They are those people that we see and we go to whenever we need help. As you can see from the graphic here, we have a whole bunch of titles, not always called a community health worker. It might be a community health specialist, a health promoter, a health liaison, among many other titles that we have seen. So they're frontline public health workers. Their services are really rooted in relationships, having a close relationship with the communities that they are serving and being from that community. They might work in all kinds of different sectors. So they can be employed in a clinic, they can be employed in a community-based organization, they can be employed in health insurance companies, lots of settings for them to be employed at. They are the people that communicate and bridge the gap between community and complicated health systems. Among many other things, they are just those people that have the big heart in our communities that really are the ones that are leading the work and reducing health disparities.
So I know, Yessie, you have worked a little bit as a community health worker, or a lot as a community health worker. Can you share a little bit about your experience and some of the settings that you've worked within?
Absolutely. I've definitely been a community health worker since I was a kid, since I could talk, since I could speak. I had to advocate for my monolingual Spanish-speaking parents. As immigrants to this country, there was a lot of things that they didn't understand about how to access health. And I was the one that was reading those papers. I was the one helping them make those appointments. At the time, there wasn't a lot of access to interpretation services. So I was not only their advocate, but also their interpreter, trying to support in that role. And those are two completely different things, but I was playing those two roles, started helping them understand. And I didn't have my formal training until 2014, where I did get to do some direct service, mainly in education, where I was supporting Latinx families understand how to pursue higher education after high school. So there's lots of ways that we can do the work of community health work, but really the essence of what I got to do was advocating for people that needed more support with finding access to the information that they needed to get either health services or transportation services or whatever it was that they needed access to.
Thank you for sharing some of your personal experience. I think it's so important to understand that the settings that community health workers work in there's such a variety of settings, and there's so many different capacities that they work within, whether it's in volunteer capacities within a health or clinical setting, or to support our families. And so I appreciate you sharing that experience.
Absolutely. Absolutely. And you know, the next slide that we have is around popular education methodology. A lot of the work that I was doing to support my parents understand this new country and this new system was teaching them. I was really trying to piece together, and a lot of times I was saying, you know how in Mexico it's this way, here it's this way. So I was really trying to make the information that was more accessible and digestible for them. And this methodology is called popular education, which a lot of community health workers use in their work with community and community organizing. And what popular education is, it's a teaching methodology that I always like to contrast with a lecture style. So this it does include components of lecture, but it's not lecture heavy. So it also has role plays, it has group activities. It's really a space that has a lot of different ways that people can learn, because we want to honor that not everybody learns in a lecture space. We recognize that this is a practice for also training community health workers, and the ultimate goal of popular education is really to create an equal and just society. And this methodology just supports in that. And one of the things that we often hear when people refer to popular education is that we are all teachers and we are all learners. And that really is something that is honored. And I can tell you from the trainings that we do, we always acknowledge the experience and the knowledge that already exists in the room. And that's what we start with. We ask people, what do you already know about education, or whatever it is that we are talking about that day? So really it is a methodology that maybe we didn't know before as popular education, but maybe most of us are already using it in a lot of ways.
And I know you've used an example, which I really love, around the butterfly and teaching, showing the compare and contrast between teaching around lecture style and popular education methodology. You want to share that?
Yeah, of course. Thank you, Janine, for reminding me. I think an easy way to understand popular education, if it's not something that you've heard about before, is that if you're in a setting and you have a kiddo that's about to learn about butterflies, you might have a lecture style setting, which is the opposite of popular education, where we might be in a classroom and we're listening to a subject matter expert talking about butterflies. And that's what we get. We're sitting down, we're not really engaging, we're listening and we're absorbing information. And that was that style. We move into popular education where the person that is facilitating might be a subject matter expert, but doesn't necessarily have to be. And they're more of a role of a facilitator to facilitate a conversation. And they might start with, what do people already know about butterflies? And build off of that. So we start with what people know, so we don't waste our time talking about the cocoons if that's something that everybody knows already, right? And then we move into group activities. We might build a butterfly. We might bring in the life cycle and actually see it. It's a different approach that is more interactive and that really builds on what's already there and is more communal and more in community space.
Wonderful. How has it been? I'm curious, being that you are the director of workforce. I know that a lot of our trainings clearly have moved to a virtual space. What has it been like using popular education methodologies in a virtual space?
My goodness, what that has been. At the beginning, I think I will confess that I was really resistant to moving into a virtual space for a lot of reasons. I think a lot of the communities that we work with, there's just a lot of issues just with the access to the internet and even devices. But now that a lot more of the people that we work with have access to those things, we have gotten really creative. We have looked into a lot of tools. We've been using Zoom. Zoom has the option to make virtual rooms so that we can create groups to have smaller group conversations. We've been introduced to tools like Jamboard, which is a virtual platform where people can interact in, it's kind of like a whiteboard, but it has options of sticky notes and pictures. We've used videos, all kinds. We've really had to get creative. We've also used, what else have we used? Oh my goodness. We've used all kinds of stuff, but we've really had to get creative, and it's possible. It's working. We gave it a try and it really worked, and we saw that we were still able to create connections and community using the new tools that we have. So that's something that people are interested in later. Maybe we can add that to our technical assistance menu.
Absolutely. I know I've been in a number of meetings where I felt like my eyeballs were drying over. So it's great to engage in something that's a little bit more interactive and stimulating my brain, for sure.
So up next, we have a video that we want to show you from the Community Health Worker Core Consensus Project that will talk more about some roles and some competencies for community health workers.
Often, people ask, what is a community health worker? Who are they? What do they do, and how do they do it? Are they outreach workers, peer educators, promotores de salud, even tribally based community health representatives? There seem to be so many diverse names. Those names reflect the diversity of the CHW field and mirror the many distinct settings and communities where CHWs serve. Are there paid CHWs and other CHWs who get stipends or even volunteer? Well, mostly CHWs are paid. Hopefully, they are paid a good living wage with benefits. Some CHWs volunteer, some because there is still limited stable funding for CHWs, and some volunteer because they want to give their time to their community. Even with all these differences among CHWs, hopefully you know a lot about what CHWs have in common. One thing you should know is that even if CHWs are not all paid or not all paid the same, CHWs are deeply committed to supporting the individuals and families where they live and work. They are part of a continuum of caring. Another important thing that CHWs share in common is their core roles and competencies, including their skills and qualities. Many people have looked to the 1998 National Community Health Advisor Study for a starting point. The study identified 7 core roles, which help define CHW's scope of practice. These roles include cultural mediation, health education, assuring access to health care and other services, informal counseling and social support, individual and community advocacy, provision of direct services, meaning health screenings and basic first aid, and individual and community capacity building to strengthen and support the skills and abilities of individuals and communities. Programs and policies to support CHW service development should ideally position community health workers to fulfill a wide range of their core roles. What happens if CHW roles are too narrowly defined? Let's take a look at what happens when a CHW works in a narrowly defined role. If a CHW teaches Diabetes 101 in a classroom but does not have the opportunity to talk with those attending the session, she cannot offer social support. Given this narrow role of health educator, the CHW might not touch the lives of those she serves, and the participants might once again be overwhelmed with the medical information about their chronic condition. They will miss the benefit of an informed ally who they can talk to about the changes they want to make and how hard it is to make them. Their condition is poorly controlled, and they may find themselves in the emergency room once again. If we want community health workers to carry out a wide variety of roles within the community, we need to make sure their training gives them the right skills. Dr. Noelle Wiggins, who led the examination of roles and competencies for the National Community Health Advisor Study, identifies 8 core skills that CHWs need, including communication skills, interpersonal skills, service coordination skills, capacity building skills, advocacy skills, teaching skills including facilitation, organizational skills including setting goals, planning, documenting, and research, and a general knowledge base, including knowledge about the community, specific health issues, and health and social service systems. The study also found that CHWs have many important qualities, the most unique and important of which is that CHWs are closely connected to the community they serve, sharing life experience. You may wonder whether these roles and competencies represent today's reality for CHWs as they did more than 16 years ago when the National Community Health Advisor Study was released. That is the purpose of the National Community Health Worker Common Core Project, also known as the C3 Project. Many of the same people who worked on the National Community Health Advisor Study are part of the C3 Project. The C3 project is focused on building forward from the National Community Health Advisor Study to offer contemporary guidance on CHW roles and skills that support the work that CHWs do today. You may also wonder, what about guidance from the C3 project on CHW qualities? The C3 project recognizes the importance of the qualities that make CHWs effective, including their close connection to the community. The project team, like others, recognizes that those qualities are timeless and have not and will not change.
And you can see some sources there, but if anybody wants more information about that video or where it comes from, we encourage you to Google the CHW Core Consensus Project. And now moving into some history of the workforce. We have this graphic here that has a whole bunch of bubbles, but I'll walk you a little bit through it. We have recorded that in the 1950s, the earliest known community health worker were known as Chinese barefoot doctors. Obviously, we know now that there's been community health workers have existed since the beginning of time, but this is what we have on record. And these Chinese barefoot doctors were doctors that were trained in a small farm worker community to address their healthcare needs with the communities that they were living in. So at the time, the doctors that were living in the city weren't really interested in traveling miles and miles into these small rural towns. So they ended up training members of the community there, and there were really rural, small, poor communities, and these doctors didn't have shoes, which is where this Chinese barefoot doctor came. This name came from. So fast forward to the 60s, China really institutionalized community health workers nationwide, which led to a huge surge in community-led programs, including countries like the US. And then in the 1970s, community health workers really started to organize and be more present at the American Public Health Association, being a voice. In 1998, we saw the National Community Health Advisor Study identifying the roles and competencies of community health worker. And then in the 2000s, there was a community health worker-led section that is now officially created at the Oregon Public Health Association. We go into 2007, where HRSA has a national workforce study that provides a national report on community health workers, describing how the workforce is really effective in addressing health needs. And as the interest is growing with community health worker programs, the demand for more adequate information grew, and then we get the assignment of an occupational code with the Bureau of Labor and Statistics. And then we're into 2010 still, and we have the Patient Affordable Care Act, where community health workers are mentioned in 3 sections of this Affordable Care Act. So now we're really entering an era or a pivotal change where community health workers are really identified as an important key component of the healthcare workforce. We're into 2014 now, where Medicaid agencies are now having the option to reimburse for community health worker preventative services, really starting a reimbursement process. And then we're here. Now we're in 2021, but 2020, what a blur. A huge national recognition for community health workers. Again, really, this pandemic has highlighted the need for community health workers and has made them even more popular. And we have now the elaborate CARES Act and CDC Act allocating $200 million to national efforts to address the pandemic. And this was really, really pivotal. Highlighting the need for community health workers.
Absolutely. And I think the value of community health workers through the pandemic, it's been interesting watching across the country, the conversations, the increased conversations around what community health workers are doing around the pandemic, whether it's contact tracing or providing educational opportunities. Especially, we know that there's so many barriers in some communities, different communities of color, in accessing services and getting information from health systems. And so we know that community health workers play such an important role, especially because their work is rooted in that relationship, that there's a lot of trust that is built. And so it's a perfect space for community health workers really to be able to lead in and provide accurate information to the communities. One of the other things that occurred that wasn't on the timeline is the Traditional Health Worker Commission. So the commission was established, and again, this is specifically in Oregon. The Traditional Health Worker Commission was established in 2013, really to advise and make recommendations to the Oregon Health Authority, or OHA, to assure delivery of high quality, culturally responsive care for Medicaid members. And the role is to support and foster use of traditional health workers as a strategy to achieve Oregon's triple aim of better health, better care, and lower costs, which we know is now the quadruple aim, as it includes equity. And really what the Traditional Health Worker Commission does is they manage, in part, they manage and provide oversight of the Traditional Health Worker Registry. So if any of the traditional health worker types, and we'll talk about the different types in just a moment, if any of them have gone through a formal training program, they're able to apply to be on the Traditional Health Worker Registry. And if they're approved to be on the registry, that means they have done a certified program and they are up to date in their certification and potentially could be reimbursed by Medicaid dollars. Another thing that the commission does is to review and approve the THW training programs. So if an entity or an organization has developed a program and it meets the competencies for the commission, they would submit it into the commission and seek approval so that if a THW completes their training with that entity, they would be essentially able to be on the registry. So they approve the trainings or decline approval of trainings for traditional health workers. So the different traditional health worker types, the umbrella that is held by the THW Commission, it acknowledges 5 different traditional health worker types. So doulas, and that's specifically birth doulas, peer support specialists, peer wellness specialists, personal health navigators, and community health workers. And while we know that there is heightened requirements for coordinated care organizations, or CCOs, to work with traditional health workers, ORCHWA as an organization really supports the work of community health workers. That is what our scope is. While we acknowledge the amazing work of all of the different traditional health worker types, our scope of services is really around supporting community health workers. One of the things that's important to acknowledge is while there is a traditional health worker registry and there are certifications and opportunities to be on the registry, it's not necessarily enticing for all community health workers to be on the registry. Some choose not to for a variety of reasons. And it doesn't mean that they are not community health workers. It means that they have specifically chosen not to be on the registry. Active currently on the registry are 603 community health workers. So those are folks who have gone through a certified training or approved training by OHA and have decided to apply to be on the registry and are accepted on the registry. So while not all CHWs choose to be on the registry or to be certified community health workers, as an organization, we support community health workers, regardless of their decision to be on the registry. And we want to make sure that there's opportunities for them to engage in services, regardless as to their decision to be on the traditional health worker registry.
Yeah, Janine, we do often get this question, how many community health workers there are in Oregon, and it's really hard to tell. We have the numbers in our membership organization, but again, it's a choice. It's a choice to be on the registry. It's a choice to be an ORCHWA member. So really, there's just a bunch of estimates thrown out, and we don't have that nice number quite yet.
Absolutely. Thank you for adding that. And I think also one of the things that's important to keep in mind is, as Yessie was sharing, when she was serving as a community health worker for her family, she wouldn't, if she were serving in that role solely for her family, she may not know about the traditional health worker registry or care. It may not be of any benefit to her. So there wouldn't be an incentive, and there'd be no way of us tracking like, oh, we have Yessie who is providing these services to her family. Again, we know that community health workers work in a variety of spaces, volunteer, not volunteer, though we do support them being paid for the services they're providing. So don't hear what I'm not saying. But we also acknowledge that community health workers work in a variety of settings whether it's in a community or a clinic or within their families. So it makes it incredibly challenging to know exactly how many community health workers there are in the state of Oregon. So thank you for bringing that up. Yes, it's important for sure. One of the other components or items that has been worked on by the Traditional Health Worker Commission is outlining of the scope of practice for each of the worker types. So this is one specific to the community health worker type. And this is what has been recognized by Oregon Health Authority as the scope of services or scope of practice for a community health worker. And the overarching buckets are care coordination, system navigation, outreach and direct service, coaching and social support, advocacy, organizing and cultural mediation, education, assessment, evaluation, and research. So as we saw the video earlier from the C3 project, a lot of these align with what that work is, but there's a little bit more detailed description of some of the activities that might entail. And why this is really important is because as billing codes open up and there's a recognition more broadly and an interest to work with community health workers, we want to make sure that there's an alignment with the reimbursement that's happening and the recognized services by the state of Oregon. So again, this is a scope of services as recognized by Oregon Health Authority, and this was approved by the commission in 2016. So why community health workers? Why do people want to work with community health workers? Why does it matter?
Why not, I say?
I mean, really. So some of the benefits for systems, and again, when we talk about systems, community health workers work in food systems, they work in education, they work in immigration, they work in corrections, they work in housing, all over the place. There are community health workers everywhere. But some of the benefits for systems to work with community health workers is it increases member access or community access to culturally appropriate and linguistically accessible services. There are clear strategies to address social needs of members. The community health worker scope of practice is well defined and includes some clear range of activities that address individual and community health and social determinants of health. There's an increased member trust of health systems and engagement and prevention services when they're working with community health workers. So again, we know that there are a lot of barriers for different communities in accessing services and accessing clinical services in particular. And so working with a community health worker can help bridge that gap where the CHW is able to serve as a liaison between the community or the individual member and the health system, which increases activities around prevention and improving health outcomes. And another reason, which we know is absolutely a driver and has highlighted the sexiness of CHWs, is the contractual requirements for CCOs to increase access and utilization of CHW services. So we know that that's absolutely a driver in part of this. And while, to be fair, there was an expectation in the previous contract, there is heightened requirement in CCO 2.0 for each of the CCOs to increase access and utilization, member utilization to CHW services. So that's definitely a driver for systems.
So what are some benefits to community members and individuals to work with a community health worker? I would say the number one thing is the trust. When you have these leaders and these connectors that already know the community, that already have the built relationships, it is easier for somebody that might have had a bad experience with the health system or certain organization that they might need support from to access this information through their community health worker that they trust. So that's, I would say, the number one thing. Equity, individual-centered care, working with members of a shared community to provide accessible service. Again, people that are from the community serving their community. Community health workers hold a lot of knowledge and cross-system navigation, connection to available resources, and they just work in service to their communities, right? So again, that huge piece of the trust of really making sure that you have not a stranger coming into a community, but really somebody that is already from that community, has those connections, and is somebody that they know will give them what they need.
And really, because why not? I think that was a great response. Why not work with a community health worker?
Yes. So now we have a thought-provoking question. Thinking about the helpers in your community, maybe they work in a community health worker setting, in your families, anywhere, these helpers, these people that help, what are some things about that person that stand out to you? And you can tell us in the chat. Just think about it. Tell us, what are some things that stand out to you about these helpers in your community?
And do they identify? I wonder if the person you're thinking of, if they identify as a community health worker. Maybe, maybe not. Other people in your family who are serving in some of the roles that we've talked about earlier? Is it someone in a clinical setting? Is it a friend maybe providing information around prevention or health and wellness? So as you're thinking about that individual, think about what it may look like for that person to work in a clinical setting. So we know that the CHW is very relationally based, and they're serving as a connector, and they're providing all these activities around support and education. Sometimes it can create some challenges being embedded in a clinical system or a really rigid system. So things to think about, not that there's a right or wrong way to work with community health workers as far as embedding them into systems, but I think just thinking about where some of the challenges or dynamics may be. I think not only for the CHW entering into a system, if they're very rooted in community, but I think also for maybe a health system doing things differently, engaging with members differently. There may be some gaps in knowledge around what does a community health worker do? What are they stepping on some of my role as a nurse or as a CNA or an MA? What does that look like? So things to think about for sure. And it's important to acknowledge that there are clinic-based community health workers and there are community-based community health workers. And when I'm saying based, I'm saying also employed. So clinic-based and clinic or health system employed versus community-based and community-based and community employed community health worker. Pros and cons to both, for sure, being in both settings, not to the CHWs, but to being in both settings, there are definitely pros and cons. One of the benefits in a clinical setting is that there is the ability to bill Medicaid. So at this time, I think I shared that there are billing codes that have been released that allow reimbursement for community health worker services. So if there's infrastructure that exists, which we know that part of that is being developed in some of the systems right now, but if the infrastructure does exist, there is the ability to bill Medicaid in a fee-for-service manner for those services. The jobs are typically a higher wage for community health workers. We know that health systems tend to pay significantly better than community-based organizations. There's also job stability. So that's something that's really important as well. I can't tell you how many stories I've heard about community health workers who are providing services and living in their car and providing those services. And maybe they're working on something that's grant funded and there may be ongoing support for that grant or maybe not. And so there creates this instability for the workforce at times, which is challenging, absolutely challenging. And then also clinics and health systems, a lot of them are newer to working with the CHW workforce. And so there's so much opportunity for learning about what the scope of a CHW is and really supporting fidelity of that model to support the success, not only the community health worker, but of the member who's receiving those services. And then in community-based settings, so if you have community-based and community-employed community health workers, there tend to be lack of sustainability or consistent funding. There is trust for the community-based organization. So we know with a lot of folks who are experiencing barriers in accessing health systems, they may have relationships with community-based organizations, whether it's a culturally specific organization or an organization that's embedded in their community that they have maybe received some sort of resource from or have partnered with in some way, shape, or form. There tends to be that trust and honoring of that relationship, not only with the CHW, but also with the organization, which may encourage the individual to seek services in that space, which is really important. And then also there's culturally and linguistically aligned care. So if I'm going into a community-based organization, I'm working with a community health worker, I have a pretty good or pretty appropriate assumption that they're going to understand. If I'm going to a culturally specific organization, they're going to understand potentially some of the experiences that I have. There may be that cultural alignment, or I may know that there are services that are linguistically accessible to me, which that may have been a barrier in accessing services in a clinical setting previously. Nancy, can you speak a little bit about what it means to support the workforce?
Absolutely. There's so many ways to support the workforce, and we'll talk about more specifics in a little bit. But one of the things is definitely to continue to learn about the scope of practice. In 2014, there was a focus group that was held with community health workers, and one of the outstanding patterns that came out was that community health workers said that they wish their supervisor knew more about what they do. So that's definitely something, continuing to learn about the scope of practice, participating in supervisor trainings that are specific to supervising community health workers, supporting the fidelity of the model, which we have said a lot today, which includes services in all care settings. Honoring the people that do the work and self-determination, nothing about us without us, making sure that if you're making decisions wherever you're at, whether it's a culturally based organization or a hospital setting, that we are including the voices of the people doing the work and the people that are being served. We cannot forget that piece, and that cannot be an afterthought. That is how we will see some programs fail sometimes. So let's make sure that we include that voice in the beginning. And ensuring inclusion of promising practices to continue to support workforce retention, to just name a few. And moving into our next slide, we have more specifics.
So on a macro level, when we're thinking about supporting the workforce, I must say that our systems aren't necessarily created, designed to support all communities. So the first thing I think about is burn the whole system down and start over. So being that we can't do that, I do think it's something to think about, though, is the structure of our existing systems and why there are so many health inequities and disparities that are impacting communities. So definitely redesigning systems, redesigning systems to be anti-oppressive and systems that strive for equity-centered, linguistically aligned, and culturally honoring service delivery. So important. So important.
And on the meso level, we can see identifying metrics of success determined by the community health worker or in partnership with the community health worker, metrics that are realistic and include both short-term and long-term outcomes, compensating above locally determined living wage, and providing comprehensive benefits. As Janine was talking about earlier, we hate to hear about community health workers that are living in their car or having to take up an additional job at a local grocery store. That is not okay. We need to make sure that these helpers in our communities have a livable wage and more. Livable wage is not enough. Intentionally developing infrastructure to support the workforce stability as well. And at the micro level,
it's ensuring that social services are resourced. Oh my goodness, it's so challenging to be in the community and wanting to connect someone to a resource that does not exist. No matter how many community health workers you work with, they speak time and time again about wanting to connect members to resources, whether it's utility assistance or rental assistance or food, and there's no resource at the other end. So there can, at times, there's a lot of conversation that happens around developing infrastructure, providing different call lines to support connection, but then there's not the investment into the resources to connect the community to, which we need. It's so important that there's the investment in resources so that people can access those resources. And remembering that it's not the community health worker who addresses all the social determinants of health. They're part of the strategy to make that happen. They're a connection piece. But if we don't invest in the resources, the outcomes are going to be very, very similar. So investing in resources, so important. I'm investing in opportunities. So when we're thinking about the workforce on a micro level, investing in opportunities that support the professional development and continued learning for the CHW workforce, which means making sure that there's time and space built in for them to attend classes, or if there's an area of interest, maybe it's around clinical settings or providing other types of services or focused education around chronic disease management or whatever it is, that the employer is supporting them and accessing those services, making sure that they have time that's built in and also time for self-care. You can have compassion fatigue. It's a real thing. And so really supporting the CHW who's providing those direct services and incredibly impacted not only by the individual who's receiving those services, but also their own experience in navigating the systems, which can be challenging at times, making sure that we're supporting and that you as an employer are supporting opportunities and access around self-care and professional development. So, so important.
Thank you, Janine. And I think some of those we can walk away with today as maybe a homework that we can do back in our organizations. If you're already employing or thinking about employing community health workers, take one of those. And we would like to leave you all with this quote, "Nothing about us without us." Just as a reminder, it is something that is often talked about in community health worker space. And just a reminder to you all and an encouragement to always remember to include community health workers in whatever conversations you're having that is about community health workers.
Absolutely. And again, it's great that there are the contractual requirements to work with community health workers. And if we want the work to be successful, we have to authentically engage in the work and support the provision of care in various settings, whether it's in a clinical setting or whether it's in a community-based setting, and really leaning on the knowledge and expertise of the community health worker. So it's not just checking the box around the deliverable of, hey, we've increased access, but we're truly invested in the health and well-being of the CHW workforce as well as the community, which means that authentic engagement, continuing to learn as systems around what the scope of the CHW is, making sure that they're included in decisions that are being made and programs that are being created and metrics that are being developed. So important. And it was so lovely to be with you today. Thank you for welcoming us here. Again, my name is Janine Smart, and I'm the Executive Director for ORCHWA.
And my name is Yessi Castro, and I'm the Workforce Development Director, and it has been a pleasure to be with you all in this space today. If you would like to learn more, please visit our website at orchwa.org. If you want more information and would like to sign up to our listserv, email info@orchwa.org. And let's talk. We would love to hear from you soon.
Absolutely. Good luck on your CHW partnership journeys.